a nurse by profession, and I'm also a public health nurse. They're looking for O positive, and I'm O positive. So I just went. I was like, let me donate for this lady now, no problem. I think I was always donating. They knew me in the lab. She's here again. And actually for international recruiter, when they see that you have a track record, it will make you stand out. I said any above. So I'll leave it at that. Don't wait for an opportunity to meet you before you are prepared for the opportunity. Prepare yourself before the opportunity comes, so that the opportunity will meet you prepared.
How do nurses go into public health? We have another guest on the Beyond the Bedside series, and
Hi.
yeah, welcome to my channel.
Thank you.
I hope you guys are enjoying the series at this point. This is our third guest, and I'm so excited to have you here today.
Thank you very much.
Thank you for coming. Please introduce yourself and also give us your social media handles.
Okay. Hello everyone, my name is Yuki Anita Omogun. I just gave my full government name. I'm a nurse by profession. I'm a midwife, and I'm also a public health nurse. Aside from being a nurse, I love the good life, and I love talking to nursing students, helping them to navigate their career paths. Social media handles. So Instagram is Yuki's Touch, YouTube Yuki's Touch.
What videos do you post on YouTube?
Okay, so I post lifestyle content sometimes, then nursing related content, and also faith-based content.
I'd like to know what school you attended. How was school for you in general? Like,
I went to Bowen University, Iwo Osun State. I got admission. That's initially they didn't give me nursing.
Okay, you're the second
story for let me just give you a nitty gritty.
Okay.
So I wanted nursing. They didn't give me nursing. Despite my JAM score, it was good. If I do say so, it was good. They gave me zoology.
Hey.
I think I made a post about that on my Instagram.
Okay. Zoology, like,
can you imagine? They made fun of me at home. They were like, I'm going to take care of the chickens and the goats in the village. So they gave me zoology, and I went back. I traveled to Bowen for them to do a change of course for me. I was not going to. Right from time, I can't take no for an answer.
Wow.
They changed it to nursing. I was like, thank you. We move. Got to Bowen, started school in 2016, yes. Nursing 5 years course. I was a bit active. When I was in 300 level, I contested to be the public relations officer. That was because the information between preclinicals and clinicals, it was not there. There was no access to information. We didn't know ourselves. So I saw a problem. I was like, okay, let me see if I can address this problem using social media. I started using the social media page properly to disseminate information, got student representative across all levels so that information will be shared faster and correctly. 400/500 level, I was like, let me take this up a notch because there are still some things that need fixing, and I think I can do this. I vied for the position of president. I won. Wow, I had an opponent. Yes.
Hey.
When you should see that, I was just, my manifesto is still in my laptop. When I'm reading, I'm like, Yuki, you promised all these things. And I thank God that I actually achieved them. It was challenging because I got to work with students from 100 level to my level as well. And when you are working with people, when you are in a team, you need to understand that people have different personality. People interpret your words differently, and you just have to be calm. It was so tough.
I swear.
It was tough. It was not just the students, it was with lecturers, it was with people from other departments as well. I got into trouble one time with my lecturer. Wow. Because I have coconut head.
Hey, you know they hear words.
I don't used to hear words, to be honest, but I thank God that I was able to change some things. Nursing students, they are benefiting from the impact that I made back then. So I'm happy I was able to do something. I was also the president of Bowen University South Student Association.
Wow.
Ogumosho chapter. So it was nice. I did things.
You're able to balance that and your academics.
I was able to do that.
Wow, that's so nice. How did you even think about studying nursing, like, in the first place?
That's a beautiful question.
Do you have any nurse in your family? Or
at the moment, I know I'm saying at the moment, I'm the only nurse in my family. My choice It was greatly influenced by my grandparents. So I was raised by my grandparents, and my grandma, she's diabetic. Growing up, I always saw her taking her medications, started taking insulin pen, and I was helping her to do that. So I was like, okay, I like my grandparents a lot. I want to take care of you properly. So I just chose nursing, and I thank God that they were able to see me graduate. Yes, they attended
Oh,
my induction.
oh my
So
God.
it was
That would have been so
beautiful. It
beautiful.
was actually.
Wow, wow, wow.
So I always knew for a fact that
You're
I
going to do
want
public
to
health.
specialize in public health, and not just public health, control of infectious disease. I have a thing for hygiene. I like things being clean. I don't like when people fall sick, especially when it can be prevented. So I've always been about health promotion and disease prevention. But I didn't just know, I know it's the Holy Spirit. That burden has always been in my heart, right? But I didn't just know the right way to go about it. In school, I was doing a lot of things, but it was always leaning towards health promotion and disease prevention. After school, and with everything that I faced, just pointed me to the right direction, and everything just started making sense. So I think that's a word out there for someone. It
Okay.
might not make sense now, but
Yeah,
just keep
but
pushing, trust the
and it's
process.
okay for it to not make sense now. Like,
Exactly.
Jesus, can we relax? Because there are lots of people that are like, what are you going to do when you finish? And if I say, I don't really
You
know
can say you
now,
don't know because you
they'll be
don't
like,
know.
you don't know.
You don't
It's
know.
okay to not know.
Exactly.
This is like one of the reasons why I decided to do this series, because I don't know where I want to specialize yet for a fact, but I know that I don't want to I don't want to be in the
Bedside.
bedside. So why not just bring nurses that are
Already in that
already in
space.
different specialties? Let me hear from them, and then I decide, right? And I know that there are a lot of nursing students that are in the same position as me,
I
right?
know.
It's
I
like we're
know.
helping each other.
Honestly, what you
Yeah.
just said now, it's so profound because
Mm.
most nursing students, they don't know.
Yes.
And I've not seen a lot of people that are talking about the different specializations in nursing. I just wish that every nursing student will take their time to do their own homework.
Mm-hmm.
Check Google. In a nutshell,
Mm.
it was an eye-opening experience.
Mm.
Let me use that word. I cannot say it was beautiful as a whole.
Mm.
I worked in different units. So the first time I was posted to general ward. It's a combination of both surgical cases and also medical cases. It exposed me to some cases that I've never seen in my life. I saw how fragile
The human life
life,
is.
maternity ward,
Mm.
beautiful. The
Wow.
matron, sweet woman, the
Oh.
doctors, amazing.
Mm.
The nurses, superb. My
Mm.
patients, even though they're in pain, they were just amazing. The babies, cute as ever. Yes, that was beautiful. Best,
Mm-hmm.
A and E.
I
Oh
swear, A&E
God,
was so good for me.
the synergy.
The synergy. The relationship I have with A&E is toxic. Because
You don't
yes,
mean
I
it.
love the vibe and all, but it drains me. Jesus.
Draining. Public health nursing,
Mm-hmm.
it's an area of specialization in the nursing practice that deals with health promotion and disease prevention, basically for communities. Who makes up the communities? People, school, units of the community. So we have school, we have even hospitals, we have the marketplace. How I see public health nursing, we are taking healthcare
Mm.
to meet you.
Wow.
And it can be done in different ways through health education, health promotion, disease prevention.
Mm-hmm.
That is the way that I can explain it.
Okay.
Yes. And you are not treating animals, you're
Yeah.
treating humans.
Public health nursing is also very diverse.
Yes,
There are
it
different
is.
aspects.
Different scopes. Whew.
Yeah. Does he go all the way to like policy,
Yes.
administration, research?
Yes. I uploaded something yesterday on my story. about public health nursing, different specialties. Now, in the public health nursing, I'll share it with you. You have school health nurse, you have
Yeah, I've heard
occupational
of school
health
health
nurse, child and maternity nurse, immunization and vaccinology,
Yeah.
community health nurse is there. It's broad. There's epidemiology, there's research. So global health is there. Then also infection control nurse. That's what I want to do in the long run. It's
So
wide.
broad.
We've not even explored it.
Like
Even
Nigeria would not
1%.
even scratch it
Not
at all.
smelt it.
Because
Honestly.
most of the people that I see doing all this like public health nursing content abroad, you see them making like health policies.
Yes.
That
And your voice
immunization.
matters. You're not, nobody's going to shut you
Yes.
or say you are just enough.
And you can have your own platform, do your thing.
True.
That's what I really love about public health nurses.
So immediately after my internship, I was volunteering with an NGO at that time.
Okay.
So I started my internship December 2021, and I started volunteering with that NGO January or February 2022. It was the NGO that I was volunteering with.
Okay.
When I just came to Abuja, they absorbed me.
Wow.
Yes. That period stretched me. Because that was the first time that I was working in an administrative setting. Shout out to Angela Omieza. She's the founder of Jealous Development Initiative, the NGO that I was volunteering with.
Is it here in Abuja?
Yes. So what we do at JDI, we have 4 aspects. We believe that human life depends on clean water, mental health, volunteering through youth empowerment, right? Yes. Then blood, voluntary blood donation. Me, I chose voluntary blood donation.
Yeah, because like on your page, I used to see a lot of like blood donation, blood. Where did that interest come from?
I was always donating blood when I was in school. And I remember there was a woman that did, I think she did double mastectomy. And they were looking for a voluntary blood donor. A message was sent to my group chat. They were looking for O positive, and I'm O positive. So I just went, let them donate for this lady now, no problem. And I think I was always donating. They knew me in the lab. She's here again. And that was when my love for voluntary blood donation started. Even before I knew that I was moving to Abuja. So I can just see God was in every detail. Yeah. So when I came to Abuja, I remember during the volunteer orientation, they just told us about the different aspects. My mind was already in blood donation, like there. Wow. So they're creating content for them for blood donation, and we have an app called J Blood Match. Okay. It's an app that connects voluntary blood donors to their match. It's online, it's live, it's working. First of all, you have to be legal. A 14-year-old cannot come and say he wants to donate blood. Where's your parents' consent? Screening, you have to be screened. You can't just donate blood like that. The fact that you want to save a life doesn't mean that you will not really come and give.
Come and kill the person faster.
Exactly. And the truth is that you might be healthy, but having a healthy blood doesn't mean that you are compatible with the person that you want to donate the blood to. So the first thing that they will do is to screen you for diseases such as HIV, syphilis, hepatitis.
Those are like the main.
Those are the main things. Then blood group will be checked. Okay. Resource factor. Then the most important one, the pack cell volume. Yes. PCV. Yes. So correct me if I'm wrong, for female between 34 to 38, right? For male, I think it's 37 to 38 or 40, thereabouts. And we know why for females, because of menstruation every month. Before you donate blood, they'll ask for your consent. You have to eat. Please eat, be hydrated. When the process of withdrawing the blood is done, you have to relax a bit, then go home. You'll be fine.
So you mentioned when you were done with internship and all that, you worked in an NGO. And I remember there was a time I was checking sites that I could volunteer. And I'm like, I'm not really seeing these things.
True.
How do I find those sites where I can volunteer in NGOs?
Okay, I don't know about any sites in particular. I think most times we just see these things by chance. Like me now, I saw mine on someone's WhatsApp status.
Wow.
I'm serious. Sometimes
Very
it happens
random.
by very, very random. It happens by chance. And now that you've mentioned it, it's true. There's no particular site, or if there is, I've not come across it. Maybe I'll take that as an assignment. So volunteering is a good way to start. I'm a serial volunteer. I always talk about volunteering. It's good because it makes you stand out. And especially for international recruiters or international organization, when they see that you have a track record of volunteering and volunteering in a smart way, what did you contribute? What did you do? What did you learn? It will make you stand out. And they see that this person is not just interested in making money. Money is good, though, please, but volunteering, it will open doors for you.
Yes.
It will provide a long-time connection. I think what put me out there was because I volunteered with JDI, and the people that I've met, what I've done, the knowledge that I have now is because of how I volunteered with JDI. When I was a volunteer and when I even started working, we organized blood donation drive. I've not done that before. I learned. I've not sent email before. It's not that I haven't, but
Like
proper one. I made mistakes. I was corrected. During my time there, myself and my other team members were able to train 200 plus people in the whole of Nigeria concerning blood donation advocacy. I've never done that before. But being in that organization stretched me. I made mistakes and I was corrected. So that is what volunteering does. It will stretch you. I've always traced back my story in public health, or rather the love for public health, how it's expressed, the expression of it. It was through JDI.
Wow. Now, how do nurses go into public health?
Write the exam. Public health nursing is post-basic. It's a qualification or a certification that you get after you write your general nursing. That is after you are registered as a nurse. Now I know everybody is saying I'm a nurse. I always ask for license, my sister.
If you don't have the license,
you are not a nurse.
Yeah, a what? Quack.
A quack do. A quack. I'm against quackery. Every sense.
Bad.
It's terrible.
Bad.
So you need to be a licensed nurse. You're post basic in public health. The exam was nice. We wrote school health something.
Did you do there's this other thing aside your project?
Yes, I know.
Is it Mothercraft?
Yes, watercraft. Some people did soap. Some people did apron.
Like that. Yes.
I don't even know what I
did.
I can't remember what I did.
But it was so fun. Public health was fun.
You don't see how well you can adapt in a community setting. Getting your license is one thing. Expressing yourself as a public health nurse is another thing. I keep telling people, don't wait for an opportunity to meet you before you are prepared for the opportunity. Instead, prepare yourself before the opportunity comes so that the opportunity will meet you prepared. What I'm doing now, or what I've been doing, very strategic. Public health nursing has to do with health education, disease prevention, and health promotion. Using social media as a tool. Put yourself out there. How did you see into social media? No?
Yeah.
Talk about it. Talk about things that will promote good health and well-being. Because you are in this space, people will trust you more because you are licensed to do so. Anybody can talk about it, but you are an authority in that space. People will trust more in what you are saying because you are an expert in that field. Every information that you put out there, people will hold you by that because why? You are in that field. That's why we cannot slack. Do your proper research. And you even have an advantage because you have seen what not having a good health can do to people. You've also seen how these things can be prevented. During Ebola, because people were scared, they were ignorant, they started drinking salt. They led to their death. False information kills faster. Like I said, don't wait for an opportunity to meet you before you are prepared. Create that space, just like what you are doing now. Use social media because we're in a digital age. You don't know where your video will go to. Your video is definitely going to make you stand out.
Another question here is, where can public health nurses work?
Everywhere.
Everywhere.
Yes.
So even in the hospital?
Yes. I gave different areas in public health, and I mentioned infection control nurse. Where will you see an infection control nurse in the hospital? Labs, yes. Infection control nurse can work. You are not taking the position of a lab scientist, though. You are basically reducing the rate of infection. You know, we have hospital-acquired infection.
Yes.
I think it has been changed.
Nosocomial.
Yes, thank God my book is here. I wrote it. So it has been changed from hospital-acquired infection to healthcare something.
Oh.
I will check it in my book. The work of a nurse generally is to promote health, to make people feel better, to administer medication. I'm not saying that is your primary duty, to provide care in all aspects, physical, mental. Being a public health nurse, you are not excused from treating people. You understand? It's a choice. It makes you stand out, and it opens more doors for you. Community health nurses, they work in hospitals too. A public health nurse can function as a nurse researcher. You can work with international organizations like UN, WHO, USAID. Even in Nigeria, I know a nurse.
Okay.
He will not vex for me. I'll mention his name. Fawole Israel. He's amazing. He's putting nurses in the spotlight. So he was the former speaker for youth. When he was in school, he went to Lautech. Fawole was already doing journalism, activism, advocacy, student unionism, all the isms. He was the former president for Nursing Student Association. That's how we even met. This young man is doing great things. This boy is not in the country right now. He's very silent, go-getter.
Oh my God.
And he's into policy. He's a researcher.
Wow.
So these are the people that we want to see. He's doing well.
All these organizations like all this UNICEF,
Yeah.
WHO.
Check their page. Guess what you will see? Volunteer something. I'm not even joking.
Wow.
Check. Volunteer, internship. They will not say position for this. They will not put, we are looking for a public health nurse. No. And the truth is that if they want to get people, it's their person they will get.
True. The last person said that yes, they will put this thing there that yes, we're looking for.
But they already have their people.
They play before you even tap on it. Somebody has already gotten it. So
they have their people.
This soft nursing is like hot cake. You need to actually connect, and that's something that volunteering does. Yeah? That networking and
very
knowing
important.
people.
Very, very important. I'm big on networking.
Yeah.
Yes, I'm big on networking from school, and it became even better when I joined JDI because the founder, she's big on networking. She networks so well. She's an amazing woman. She's polite. She taught me a lot of things, how to negotiate, and she's a lawyer.
Wow.
But she does other things too. She expresses herself in different ways. It's something I admire, and which is something that some nurses can learn from as well. Being a nurse should not be your whole identity.
Yes.
You're a human being. You're a child of God first. So anything that you do, think of how that person will feel, and always remember that you are going to give feedback. You are going to answer questions. God is going to ask you, what did you do? That kind of thing. God will watch. So do anything that you want to do it with excellence. Don't do it. Don't do it anyhow. Want to be a nurse, be a fine nurse, dress well, smell nice, iron your uniform, give proper care to your patients. To be honest, it's not easy. Some patients will annoy you. Ask God to help you.
Ask God to help you. Very important. But you see that part about being neat, like just present yourself well.
Because people respect you.
Well.
They are not going to see your spirit first. It's what you are putting on that they will see.
And that's exactly how they will treat you based on how you look. So I hate when I see nurses on social media doing some kind of things. Like, if you know that you're not supposed to go out somewhere with your uniform, I don't understand why I'm seeing you in the market with your uniform. Like, that's it builds something in me. As a human being, as a nurse, carry yourself with
properly.
Yes. So that nobody will talk to you anyhow. Very, very, very important.
True.
Tell us about your brand.
I have a picture of how I want people to see me.
Okay.
Or rather, I see myself as your nursing best friend. Like, I want to be able to teach nursing students, hold their hands. I'm like, okay, you are confused in this area, where let's journey together. Let's do this thing. My phone is always open. Call me. I have plenty nursing students. How far? What's going on? Because
you guys are hearing it now. If you have any question about public health,
I did here
to her comment section.
Honestly, I'm here. I want people to see me as Yuki, that nurse that helps nursing students to navigate their career path. That nurse that has created a space for herself to help other people come in public health. And I want people to see me as the nurse that did not settle for the norm.
Public health nurses, I don't even know where they are. They're not really bringing themselves. Do you get? You have to search the oceans to find one, and then your page shows that you have passion for what you're doing. Yeah. When I saw it that first time, it was blood donation. I was like, oh, ma, this girl is serious about it. She's not playing at all. They have to be like, should I go and donate blood? You know, instead of giving me the, okay, let's, and then your other page, your 360 health and hygiene.
Yes, so that I didn't talk about it.
Yes, that's what I want you to even talk about. You go to schools and all those kind of gatherings, and I feel like that is so interesting and so lovely.
Thank you.
So please just tell us about how you created it, what it's about. Yeah.
360 health and hygiene. Started it in 2021, back in school. Why did I start it? My classmates, they were falling ill. Anytime I entered some of their rooms, their waste bin be full. Dirt everywhere. And I'm not saying this to shame some of them. We had exams back to back that time. And because of that stress, they were falling ill. It was just a whole lot. That was one problem I identified. The second problem was I was seeing plastic bottles everywhere. So the main aim for 360 Health and Hygiene Network was just to reduce the rate at which students were falling ill and also to recycle. Yes, that recycling part, I didn't do it because it was just passion driven. I want to change the world. I want to change the whole world.
And this country alone, Amo, is a lot.
See, my sister. And I'm also a big fan of hygiene. Like, I believe that when a place is clean, it will reduce the rate at which microorganisms grow. And these microorganisms are the ones causing these illnesses. So I just thought about it. And I started using social media as a tool that time to just talk about hygiene, health. Over the years, I was not consistent again because of life generally. I didn't get it registered. This year, I officially registered it. We had to do a lot of, I say we because me and my team, one of my team members, they are nursing students.
Oh,
yes.
Wow.
Before I registered it this year, I was like, okay, I want to use social media as a tool to influence people's health choices. Let me rewind a bit. So in school, I started a social media post called Fruit Friday. I'll choose fruits that people are aware of or they are not aware of. I'll write the botanical name and fun fact about that fruit. Then I'll use Twitter as well to just share posts about some tiny hygiene habits that you are ignoring that is causing you to fall sick. For example, pillowcases. I was like, you've not changed your pillowcase for like a month and you are surprised that you have pimples or you have a cold. Change it, just little things like that.
So you post these things on like your status and all that?
On Instagram, on Twitter. I had a graphic designer that volunteered and other students that were helping me to do that. So last year, 2 years ago, I was like, okay, now let's fine tune this thing. Let me add professional collaboration. I started something called Beyond the Hospital, Conversations with Medics on Diverse Healthcare Paths. My first guest was Oluwatomi Akin Ola. She's not a nurse, she's not a doctor, she's not a physiotherapist. She's a public health enthusiast. That conversation stirred up questions, and I did another one with Sarah Martin. Everything was done through connection. That's why I'm big on networking, talk to people. I'm saying all these things just to bring you to how we restructured. So we had to change everything to this. I wanted to capture what we are doing. Building a healthy society through control of infectious diseases, access to clean water, menstrual health and hygiene, professional collaboration. That was what crowned everything. started creating posts that people can relate to, so people will change their behaviors. The truth is that people are used to the norms. There are some things that we talk about that we don't even do, especially hand washing.
Yeah.
Plenty things that we health professionals we know that we don't even put into practice. So that's why I am still, and I hope I continue, using social media as a tool to influence people's health choices.
So that's what 360 Health and Hygiene
It's all about.
is all about. You're doing great with 360 Health and Hygiene, and I cannot wait to
Thank
see how
you.
God will elevate you.
By God's grace.
More than this, I want to see Nurse Yuki on my screen. I want to see you like on that round table and be like, oh my
Amen.
God, I know this.
Thank you.
You're welcome.
It depends on where you're working. So I'm going to say where I used to work, it's a clinic, and it's different from a hospital.
Okay.
Because the number of patients that you see is different. How the clinic is being run is different. So it's just a 3-bed.
Wow.
Yes. Typical day, resume 9 a.m. It's a 9 to 5, right? You don't work on weekends.
Wow.
So 9 to 4. I have an office. I'll enter my office. I'll be there.
Hey,
So,
God, I beg.
and it's not that I'm just there with laptop. No, I'm seeing patients.
Wow.
So it depends on where you are working. The beauty is that I'm able to interact with my patients. So I function there as an occupational health nurse. I'm a public health nurse, good and fine. I function as an occupational health nurse. I function as a health educator. I'll give you immunization. And just the other things that comes with being a nurse. If we have a patient, we'll admit the patient, administer the medication. There are some times that we'll have emergency cases and you need to act fast. Why I say I function as occupational health nurse, because I'm working in an administrative setting. Sometimes we take healthcare to meet them. For example, first aid. During sports, we provide first aid. We'll check the blood pressure I used to work in a military organization. So we'll check the blood pressure of senior officers. And that is where your role as a nurse falls in. Not just checking it. Since you are checking it, it's a record, right? If there's something wrong, call their attention to it, ask them questions, take your medication, what's going on. So that's how a typical day is.
You're working as an occupational health nurse.
Yes.
Okay. So what if you're doing the normal public health that we know that you go to community
survey, go there, get information, come back, plan, budgets. And nursing, is it nursing care plan now? Yes. It's the same thing. Let me break it down as doing project management. First thing I do is assessments.
Okay.
You want to carry out a project, Abby. What is the aim of that project? You go to the school, assess the school. You cannot just enter any school like that. Get a letter from the proper authority and present it to the school principal. Yes, you do your assessment, number of students, draw out your budget, transportation, media, all those things.
Yeah.
Then planning. You start planning the dates. Does it work with everybody? Choose a proposed. You always need to have a proposed date. Has to be documented. Then implementation. That planning, is it a month this thing? How are you going to draw out the plan? We're talking about care plan. We're using care plan to explain these things. You see why nursing is sweet? That's why everything they taught us in school, you need to apply it, right? Now that you've done everything, was it good? Okay. What were the setbacks that we didn't make any mistake? How can we learn from it? These people benefit from this thing. Are we going to do it again? Evaluation, and circle goes on and on. If you use nursing
care plan, that would be so interesting.
Yes.
Oh my God, that would be so interesting.
I had a tax. We had more than 1,000 people that were registered on J Blood Match. So I was calling them to register on the app before they registered on Telegram. I learned how to write scripts, all thanks to Angela Oneza. I learned how to talk to people on the phone. I learned how to use laptop, Excel sheets. What was this person's feedback? I'll write it there. So it was an experience. Customer care. Hello, my name is Nurse Yuki. I'm calling from Jela's Development Initiative. Hope you're doing well. Is this the right time to talk? Yes. Is this the right time? Okay, good, I'm fine. So I called to tell you about J Blood Match. All these things I have to say it within 1 minute. Yes, I learned. there?
Last hospital I worked in, I saw a nurse that was working with, there's always that section in the hospital that you can do your HIV test, tuberculosis,
Yeah.
they give drugs for free and all of that. So she was working there. The organization is under the hospital. The hospital is not paying them. It's an international organization. Just come do her thing. She had her own office. She would collect patients, like, and all these kind of establishments, they give them things for free. They have like 13th month salary. There was a day that I was like, come, you are too happy here. How much are you earning? And she was now telling me something around like, was it 300k or 400k? And they pay them 13th month. They don't work every day. I'm just like, really? In this same hospital that me, I'm suffering, I'm dying. You are in one side and you're joining. And you see them like they look. So what area, like how do you even get to a point where you work with those international organizations?
If you recall what I said earlier about networking and all these organizations absorbing it to their own people, we don't know her story.
Yeah.
Truth. We don't know it was based on recommendation.
True.
You honestly don't know. Play your part, stand out. Someone see truth. There are some things that it's just recommendation. You don't even need to send your CV.
It makes so much sense now that you're saying it. Because I'm just like, there's no way they just saw you somewhere and they're like, please, can you come and help us? No, this has to be
Exactly
some kind of link.
Help yourself.
Help yourself.
This is something I've observed in nursing. We gatekeep a lot.
The gatekeeping starts from school.
Gatekeeping materials. Thank you, Jesus. We gatekeep materials.
No.
If there's water in the hostel, you gatekeep. You will not talk.
The lecturer says something, you hold on.
It's not healthy. Help one another. Ask questions. I don't want them to get to me. So they don't know what I'm doing. How did I get there?
Like, relax.
There's a place of grace. Yes, God helps you to get to this position. The truth is that, like I mentioned earlier, everything that I've been saying is just opportunity. It's just God, though. I even started working my previous place. It was God.
Wow.
It was recommendation. It was call. We need also and so, and I was just at the right place at the right time. I'm like,
wow.
All right,
That's so nice.
That is it.
One nurse, she was like, wait, though, there are nurses that are comfortable in this country.
Yeah.
What are you people doing? Then I now commented that, there are people that are earning,
There are people that are earning dollars.
They are earning dollars. Like that place I talked about.
Yeah.
I think they won't pay them in dollars. Because it's like a US owned kind of. Do you get? So the woman is just all laughy, chatty. They got 500 people. Me, I'm there like, hey, this people are too much. They're like, come.
Absorb me.
So yes, public health nursing is, even though we should not be looking at only the financial part, but it's necessary because nurses are suffered too much in this country that yes, we need to also look at the financial part so that we'll be comfortable. Nigerians don't like talking about what they earn in details, but at this point you have worked with like a lot of organizations. So can you give us like a range? Salary
no problem.
in any of these organizations, just like you don't have to mention the name of the organization, but just a range.
So I will start recently. I fought for it because I'm like, this is rubbish. I was earning above 160. After I fought, like, let's see this. I started earning above 260. So I'll leave it at that. Wow. Yes. Excluding transportation. I'm not paying for transportation. I'm not paying for accommodation.
That is nice. And then that place I said the woman was earning like 300 to 400. But that one I don't know if
it's dollars or naira.
No, it has to be in naira. Maybe we should convert anybody.
But the truth is that it's not enough, my sister. I wish we'll be paid based on our qualification. If that makes sense.
Yeah.
So imagine someone we are triple qualified and we have a degree. Pay us. That salary, it's what is really discouraging people, and that's what makes people to travel out to see greener pasture. Because the truth is that it's not easy. People have family. It's not easy.
There is a stereotype about people in public health field.
Really?
Yay!
I don't know. Let me
Public
hear it.
health money.
It's a lie.
Public health dollars.
It's a big lie.
When I was in school, anytime we have lectures, you see lecturers, they look like they're going through a lot. They look like they need a hug. But then
That's funny.
But then you see public health lecturers. It's just so different. First time we're having a public health class. Normally, we're Nigerian students now. The class is not fun. We don't even feel the heat again. You know, we're so used to the environment. The man entered. First of all, he came with a pad, like an iPad. And I'm just like,
what's going on here?
And he walked inside. He was like, "You guys don't have ACs here." We're like, So what do you say? You know, we had to go and bring a fan for that man. We mounted the fan. We looked for extension. Put it in. The man was like, "Okay, can I get a seat?" And like we made this man so comfortable. Then he's just like, "Okay, so I'll be a lecturer for public health." And everybody's like, And he's put around. He brought out an iPhone. Like, oh my God! The other lecturer we had in public health,
Like soft.
he said something. Was like yellow fever vaccine. You know, my wife and children in the States. I said no.
Just the States.
Like no. There's something
in
in this public health. So yes, I know that everybody might not be experiencing that, but then it shows that
there's something there.
You can get there. Right?
Mm-hmm.
So what do you have to say about that?
So I believe in growth, right? And just the way at the workplace you have entry level. So these people that you're looking up to, that they look nice, looking beautiful, they started somewhere. I think you should ask them, they'll be like, my salary was 4K. Like what? They were just volunteering and doing their thing. So for you to start earning a lot of money, I feel, this is just my own personal opinion. I feel you would have built yourself to a certain level. Work experience, it's there. Your qualifications too is there. You can't expect a master's holder to be earning the same salary as a BNSC holder. You can't expect someone that even has a master's degree and has years of experience, maybe as I was still a volunteer, volunteered with different organizations and has other qualifications, right, to be earning the same salary with someone that just has a master's. Levels day. Give an example. I went through UN's website. I just said, let me enter that place. Let me see. So there were some job descriptions. I can't remember in details. Like regional director for something. That's to do with health, that kind of thing. Then I'll put job description. Be able to be something map. What is this? I was just saying things. I saw salary.
Who?
I saw $13,000 a month. I'll not forget one thing. Yeah. How many years experience? I think I saw maybe 15 years experience. No, that 15 years experience, let me bust your brain. That experience can start from school. The volunteering experience too is there. So the truth is that it's all these things, it's all encompassing. Nothing is wasted. So do your part and be excellent at it. This is my advice to both nursing students and nurses. Please, you are representing yourself, you are representing your profession. Try as much as possible to represent the profession well. Books, yes, it's good to study, but are you applying what you are studying? Are you putting it into practice? Network to ask questions, talk to people from other fields. If you see someone that you admire, ask them, so how did you get here? Let me tell you something. Most times, you see these organizations. I think any place of employment now, they check your social media. Not just LinkedIn. If you like, publish yourself on LinkedIn, no problem. They'll check your Twitter. That's true. They'll check your comments. They'll see the kind of person that you are, that you're insulting people.
Exactly.
They're checking your comments. They're checking your TikTok, your Instagram. There are some things that when you apply for, they'll tell you, they'll say put your social media handle. They want to see the kind of person that wants to come to the organization, because the truth is that Yes, you're representing the profession, but you're also representing that organization. Don't be among the people that are tearing down this profession. If not, be part of people that will build it up. Is it easy? No, it's not. It starts with what you are doing. See the person you mentioned now, Defikari. She's doing well now. If you're counting 10 nurses, she will be there. If you're counting that, she will be there. She's there. That's kind of the niche for
I really love that nurses are doing good on social media. A few years ago, it was not like this. I'm sure older nurses would be like,
this new generation.
As in, this new gen.
They are not serious, so.
But we're making a move and we're creating change. The impact is there. It's there, and yeah, I like that. Thank you so much for being here today. If you guys have any question for Nurse Yuki, you go to her Instagram page, you're going to see her email. You can send her an email, reach out to her on her social media platforms. I'm going to be leaving it down below. Yes, I promise you. She's happy to respond.
Try introduce yourself.
Yeah.
Hello, my name is so and so. I'll answer you. Don't come and say hi. This was cool.
Yes, it was nice. And if I ever want to do anything public health, I know who to reach out to.
You have my number.
My big auntie.
Call me.
Nurse Yuki.
Call me. I did for you.
Yeah. Subscribe to my channel, and Nurse Yuki is also on YouTube. So please go and subscribe to her own channel.
Please
like, comment, subscribe,
and share.
Share.
Very important.
You know, we mentioned that nurses like gatekeeping. Don't be that nurse.
Exactly.
Share it to your group chat, post it on your story, let other nurses know that yes, there are options outside of the bedside.
Exactly.
Thank you guys so much, and I'll see you in my next video.
Bye everyone.